Все, наверное, сейчас это проверим. Oh, good morning, dear friends. Let's start our lectures. You have some technical problems in the start of lectures, please. I hope to see you register in lectures. Today's topic is the anatomy physiological particulars of urinary system of children, methods of investigation, this system, and semiotic of disorder of urinary system. It's for you remember urinary system of children with a Russian name of the renal development and function. Renal embryonic development includes three periods: pronephros, mesonephros, and metanephros. It's material from anatomy and histology. Kidneys start to develop between 3-4 weeks of fetal age from indifferential mesodermal non-specialized tissue. The first kidney name, pronephros. Its development in cranial part of embryo. Pronephros is only 2-5 canals. They open in cavity of body and other ending are connected in common duct, Wolff canal, then in cloaca. Pronephros does not function. Mesonephros. After 5-6 weeks of embryonal development is developed primary kidney, mesonephros. Its level of thoracal segments. Mesonephros is formed to convoluted tubules. The glomerular capsule is formed from free ending of mesonephros. Canals are connected with mesonephral duct, then are open in vesical sinus. Mesonephros functioned 2-3 months and him caudal segment take part in formation of sexual glands. Mesonephros, secondary kidney metanephros, start to development on 2 months, nearly 6 weeks of interuteral period of in caudal part from nephrotons, but excretory apparatus is formed from diverticles of mesonephral duct. Nephrons are attached to collective tubules after 20 to 26 weeks of interuterine development. In the human fetus, urine formation is believed to start between 9-12 weeks of gestation, initiating urine formation and contributing to amniotic fluid. In later stage of pregnancy, the amniotic fluids is largely derived from fetal urine. By 15 weeks, calyces, renal papulas, and renal lobes are present, and by 22 weeks, medulla and cortex are clearly demarcated, and the third of nephrons are formed. Nephron induction cases about 26 weeks of gestation. The last generation of nephrons are in cortex and are immature. These have undeveloped proximal tubules and short handless loops. The full complement of nephrons is present by 36 weeks. The full complement of nephrons is present by 36 weeks of gestation, just before the full-term burn. The growth of kidneys parallel general somatic growth, but the latent capacity of kidneys to grow continue well into adulthood. When one kidney is removed, the other kidney hypertrophies by increase in size of individual nephrons. Conclusion about now our introduce. Urinary system formed from two mesodermal parts. Then this part connects. Kidneys form in caudal part of embryo, then lift from pelvic cavity to lumbar region. This is reason of different abnormality, aplasia, agenesia, dystopia. You can see what it may be variants of aplasia and agenesia of kidney. Each individual may be disorder of kidneys development, such as variants of aplasia, its absence one organs, or abnormal absence organ with abnormal position of this organ. Variants of doubling of kidneys and ureters. You can see these different variants. The first is maybe full doubling, when we have not only doubling or variants, and ureters also doubling. This may be full doubling or semi doubling. Dystopia, it's abnormal position of kidney. You can see in maybe upper position or down position than normal. All of this position may be present, such as variant of dystopia. Variants of kidneys dystrophy also may be on these pictures. You can see such as variant of abnormality. The anatomic morphological particulars of urinary system in children. Now, first, kidney of children are relatively more than adults. 1 to 100 bodies mass of children, and 1 to 200 and 1 to 250 bodies mass of adults. Shape of kidneys is spherical, that being shape. Weight of kidneys is 64% from weight. At adult, it's nearly 30 to 35%. Place of children's kidneys is low than adults. Level of first 5 lumbar vertebrae. You remember that? And for adult is 11 thoraxis to 4 lumbar vertebrae. Fibrous capsules of newborn is more thin and lipid capsules absent. And ligaments of underdevelopment and renoxy is weak. This is reason of nephroptosis. Nephroptosis is low level position of kidney in organism than normal. Kidney has physiological global structure still to 4 to 6 years of life. If more alone, this is pathology, spongiform of kidney. Balance of cortical and medullary layers of children are 1 to 4. At adult, 1 to 2. Nephron is functional and structural unit of kidney. Glomerule is poorly differentiated, has diameter 85 microcentimeters, adult glomerulus and 200 microcentimeters. Epithelium of glomerulus is cylindrical and cubical. For adults, its epithelium is convex. Canals are smaller. Diameter of children's canal is 2 times less than adults. Handless loop is undeveloped. You can see this schematic diagram of specific transport defect and some renal tubules disorder. Pelvis is relatively more than adults. The wall is undeveloped, hypertonic because muscular and elastic fibers is not good development. This is reason of congestion of urine and inflammation. This is reason of congestion of urine and inflammation. Ureter is longer and wide, convolved muscular elements and undeveloped. Elastic fiber absence. This is the reason of megaloureters and hydronephrosis. Distal part of ureter, intravesical part, is short 0.5 centimeters of newborn and 1.5 centimeters in 10-12 years old. This is the reason of vesico-uretral reflux. This is the reason of vesico-uretral reflux. Urinary bladders place in highest and it's palpated by doctor. Muscular and elastic fibers of urinary bladder and ureters is undeveloped. Its reason reflex also too. The main function of kidneys. It includes excretory, especially nitrogen eliminative, concentrative, erythropoietic function, very interesting situation there. Homeostatic function, one of the most important in organism. Homeostatic according to pH regulation and electrolytes balance. Endocrine function also, renin, angiotensin system. The functional peculiarity of urinary system of children. The first urine is usually has specific gravity about 10-15. During the first week of life, the urine is scanty and quite dilute, probably as a result of poor response to antidiuretic hormones and immaturity of the renal tubules. Urinary specific gravity of children according to age. It's a table need for you, and you fix it information. And pay attention, especially for children's of baby's age from 1 to 12 months. Specific gravity of urine is the most lower during for another time of life. Just in this age, you can see specific gravity nearly clear water 10.02 to 10.06, and specific gravity such as adult, it's just only in age nearly 10-12 years old. During the neonatal periods, there is a low clearance of sodium chlorides and urea resulting of hypertonic urine as compared to plasma. The percentage of uric acid is higher in urine of neonate than late. Glucose and albumin may normally be present in urine. Just in neonatal period, glucose and albumin may normally be present in the urine, just only in this period. The main function dates of kidneys condition according to age. You can see clearance of endogenic creatinine milliliters per minute. Attention to adults parameters at 18 to 120 milliliters per minute. In newborn age and first year's life, and all about another part, another childhood, you can see its parameters lower than adult. It's also according to maximal tubule reabsorption of glucose. Urine volume. The average infant secretes 15 to 50 milliliters of urine per 25 hours during the first 2 days of life. 15 to 300 milliliters per day during the next week. 250 to 400 milliliters per day during the next 2 months. And 500 milliliters per day by the later half of the first year's life. There is subsequently gradual increase in urinary output, 700 to 1000 milliliters are secreted during the age 5, 8, and more than between the age of 8 to 14 years old. Its formula how calculate of urine volume after first years old when present when you have n is number of year. Number of year. Volume of urinary bladder in different age. You can see increase in newborn just only 30 milliliters. In the end of first year's life, it's just only 50 milliliters, and increase during all childhood, and finish increase and start to its volume of urinary bladder functional volume, not anatomical, it's functional volume. And starts such as adult at nearly 15 years old. Glomerular function rates is low during the first 9 months of life, as are area clearance, renal plasma flow, and maximal tubular excretory capacity also. Creatinine is secreted in large amount by infant and to a lesser degree by children to time of puberty. To the time of puberty. The male adult excreted almost no creatines, whereas female adults excreted very little. Creatine input increasing through the growth period and quantity being directly related to amount of body musculature. The urination is frequent and involuntary from newborn to 25 Okay, let's continue our lectures. Methods of investigation of kidney or urinary system. Complications: pain in lumbar region, in abdomen during urination, change color of urine, increasing pollakiuria or decreasing of fragment of urination, disorder of transparency of urine, transparency, pain, short characteristics of pain. It's localization, irradiation, periodicity, and intensity. Character of urination: bradyuria, dysuria, enuresis, nicturia, strangury, pollakiuria, change volume, daily per one urination, and voluntary or involuntary. Extrarenal complaints: thirst, headache, nausea, vomiting, dyspnea, pain in heart region. External examination: abnormality of development, position of body, change color of skin, the presence of edema, especially of face, eye, feel, lip, extremities, sides, parents need in control of body's mass, odor of urine from mouth is result of renal failure, odor of urine from mouth is result of renal failure. Abdominal asymmetry with tumor or hydronephrosis present. Estimate condition of sexual glands, secretion, edema, hyperemia, hydrocephalus, hematocephalus, hemosis. It may be also edema of face, eye fluids, extremities, sides, parents need in control of body mass. Facial edema, nephrotic syndrome at children. You can see on the pictures. Cross edema of scrotum and legs, as well as abdominal distensions from the sides. Main urinal syndrome: hematuria, microhematuria or macrohematuria, present of protein in urine, nephritic syndrome also. Leukocytic is neutrophils, pyelonephritis on lymphocytes. Hemoglobinuria, it may be mixed. How make examination of kidney? Palpation. In the norm, the kidney, as a rule, are not palpated, except for cases of sharp emaciation and flabby abdominal wall might more often happen for the woman. A low pole and of right kidneys, which in norm is posed lower than left one, can be palpated in asthenic patients. Sick patient. The kidneys become palpated in nephroptosis, pathological mobility, and increase of organ in 1.5 to 2 times. Just in this situation can palpated of kidney. If the kidney are palpated, the form, size, consistency, character of surface, mobility, and presence of mobility must be determined. Lowered kidneys is spherical bean-like form with a smooth surfaces, elastic consistency, painless. Its length about 12 centimeters. Transverse size is about 6 centimeters. The increased size of the kidneys more often can be in hydronephrosis and tumoral process. In cancer, the surface of kidney is tuberous, consistent in increased density, and the mobility is limited. And you can see different stage of hydronephrosis. Hydronephrosis, you can see it's very specific X-ray examination with an low with high contrast substance. You can see a change in structure of kidney in right and the left. Megaureters, the big diameters of ureters, and increase in parameters of calculus. Uretic dilatation and dilated clubbed calyces on the right especially. The synchronous increase of both kidneys more often where can be in polycytosis. In this case, kidneys are soft elastic consistent with rough surface. In patients with hydronephrosis, kidney are soft consistent with smooth surface. Nephroptosis can be uni and bilateral. The degree of hydronephrosis, it's maybe you can describe during practice classes, but you can see a different degree of hydronephrosis. Percussion tapping method modified Pasternatsky symptoms is used in clinical practice. The doctor stands behind the patient, put his left palm upright on lower area of the 12 rib and make a short abrupt strokes with increased force 5 and edge of right palm. The kidney are not palpated. The mobility of kidney and ureters points is absent. Pasternatsky symptoms is negative from the birth side and normal. It's also just only normal. Zimnitsky test. Zimnitsky test is a test of concentration and excreted function of kidney by specific gravity and amount of excreted urine. The main advantage of this method is that renal function is tested without interfering with the normal life of patient. The patient collected his urine at 3 hours interval, 8 portion during 24 hours. Begin to collect urine from 9 o'clock in the morning and finish at 6 o'clock in the morning for the next day. The volume of each portion of urine determined, it's necessary to compare daily diuresis amount with amount of taken liquid. And normal individuals should eliminate it about 75–80% of taken fluid during the day. The daily amount of urine below taken liquids is observed in patients with edema, negative diuresis. The amount of urine below total daily volume and volume of each voiding depends of number of factors. The amount of urine, both total daily volume and volume of each voiding, depend on number of factors: fluid intake, fluid loss from other routes, fever, or maybe environment, temperature, age. A child excreted proportionally more than an adult proportionally. Ingestion of a high protein diet, which produce more urine, or diuretic drugs, maybe. The daily amount of urine over 2,000 milliliters, its polyuria is observed in patients who take much fluid, physiological or in diabetic mellitus, during resolution of edema and after taking diuretics, in an early stage of chronic pancreatitis and renal failure. The daily amount of urine below the 500 milliliters is oliguria, maybe of patient with kidney diseases, renal insufficiency or renal failure, and unrenal diseases, vomitus, diarrhea, limited intake of fluids after hemorrhage, heart failure, and pyrexia. Concentrative function. Concentrative function. Fluctuation of specific rate, course of day, and its maximum value is determined thus. Normal specific gravity of urine from 1.005 to 1.028, and the difference between small and maximum value cannot be larger than 10 in normal. In renal insufficiency is pronounced decreased specific gravity becomes permanence. It's hypostenuria. If the renal function is upset significantly, the specific gravity of urine in position is 1.009 to 1.011, which correspond to specific gravity of primary urine or blood plasma, isostenuria. In diabetes mellitus, specific gravity more than 1.028, hyperstenuria. Combination of polyuria, which low specific gravity of urine, and nocturia is a specific signs of renal dysfunction. Combination of polyuria, low specific gravity of urine, and nocturia is a specific sign of renal dysfunction. Leber test. To determine the functional renal condition, it is possible to examine glomerular filtration as percentage of reabsorbed water. Renal insufficiency arises in cases where the mass of active parenchyma is 20% and lower of normal weight. If a substance that is filtered in glomerular but is not reabsorbed or liberated in tubules is used for assessment of renal function. The clearance of this substance is actually equal to glomerular filtration. Using this phenomenon, Weber proposed a test for studying the amount of filtration by endogenic or exogenic creatinine. If one assumes that creatinine content of plasma and glomerular filtration is the same, it's possible to determine the degree of concentration of glomerular filtrate and paste the tubules pieces. Blood is taken from the vein of patient and fasting stomach and creatinine concentration is determined. Urine is collected during 2 hours. Diuresis is measured, so the creatinine content is determined. Next, using the formula of amount of glomerular filtration, reabsorption percentage are calculated. In healthy individual, the amount of glomerular filtration is 65 to 125 milliliters per minute. The percentage of reabsorbed water is 98 to 99%. Renal failure development, glomerular filtration decrease gradually to attain as liters per minute. Tubal reabsorption change less markedly to decrease in cases of pronounced insufficiency to 80 to 60%. The prognosis value of method increase. It's used for in follow-up study. A persistent decrease in glomerular filtration to 40 50 milliliters per minute during 18-25 months follow acute glomerulonephritis suggests to conversion of acute process into chronic process. To determine the functional renal conditions, it's possible to examine concentration of urine, residual nitrogen, creatinine in blood. In normal concentration of urine is 3.33 to 8.32 millimole per liter. Residual nitrogen 14.28 to 25 millimole per liter, and creatinine in different variant it's between 53 to 106.1 millimole per liter. In renal failure, the amount increase. Chemical analysis of urine. Reaction of urine. Kidney are important for maintaining acid-base equilibrium in the body. The kidney are capable to remove the ions of hydrogen and hydrocarbonates from blood, and this is a mechanism by which pH of blood is maintained constant. The mean pH value of urine in healthy subject with normal nutrition is about 5 to 7 from 5 to 7 pH. The value of pH is affected by the use of medical preparation, characteristic of nutrition also. A diet high in meat, eggs, cheese, whole grains, palm, prunes, and cranberries includes pure juice and cranberry juice may decrease the pH, produce as an acid urine. A diet, a diet high in vegetables, citrus fluids, and milk may be increase the pH, producing an alkaline urine. Also, the urine pH may be intentionally altered to inhibit bacterial growth of urinary stone development or to facilitate the therapeutic activity of certain medications. And acid urine should be maintained in treatment of urinary tract infections and persistent bacteriuria and in management of urinary calculi. Conversion and alkaline urine should be maintained when streptomycin, neomycin, and kanamycin is used as treatment of urinary tract infection. Acidity of urine can increase in diabetes mellitus, renal insufficiency, tuberculosis of kidney, metabolic or respiratory acidosis, pyrexia, starvation. Alkaline pH occur with diarrhea and vomiting, chronic urinary tract infection due to bacterial amyloid fermentation, metabolic of respiratory alkalosis. Protein. Testing of urine for protein is based on its coagulation or presence of acid. Normal urine does not practically contain proteins. The small quantity of plasma proteins that is present in urine cannot be determined by quantitative tests used in practical medicine. The appearance of proteins in urine is called proteinuria. It can be of renal and extrarenal origin. Functional renal proteinuria is connected with the permeability of membranes in a renal filter and presents strong stimulation, fluid or blood in the glomerular intoxication. The urine will contain albumin after a cold bath, excessive exercise, efforts, and high proteins diet or orthotic posture in children, orthostatic, emotional stress. In cases with extrarenal proteinuria, proteins enter in urine from the urinary sex ducts. Extrarenal proteinuria is not exceed no more than 1 gram per liter during the usually. Organic proteinuria, renal proteinuria occur in children's affections due to increased permeability of glomeruli, which is underlined by vascular inflammation of structure disorganization of basal membrane. Glomerular permeability is upset by the molecular sieve mechanism. Low molecular proteins are lost in the first instance. Selective proteinuria. As the process progressed, high molecular proteins has also lost its non-selective proteinuria. Renal proteinuria occurs with glomerulonephritis, preeclampsia in pregnant women, or multiple myeloma, amyloidosis, renal abscesses, urinary tract stone. Congestive proteinuria may be indicated on decompensated heart failure, abdominal cavity tumor. Toxic proteinuria may be after overdose some medication, aspirin, analgesic. Neurogenic proteinuria occurs with cranial trauma, fat hemorrhage of brain, myocardial infarction, and renal colic. Proteinuria can be moderated when protein's loss is not exceed 1 gram 24 hours, average when proteins loss from 1 to 3, 24 hours, and considerable when a protein loss more than 3 grams per 24 hours. Glucose. Testing of urine for glucose can be done by using reagent strips. The urine of a healthy person contains very small quantity of glucose, which cannot be detected by common quantitative test. Glucose in the urine, glucosuria, can be both physiological and pathological. In presence of normal urine function, glucosuria occur only in increasing concentration of sugar in the blood exceed 9.9 millimole per. Physiological glucosuria can be observed in persons whose diet is rich in carbohydrates. Elementary glucose will following emotional stress and administration of some medicine, glucocorticoids or caffeines. Less frequent is renal glucosuria associated with distributed reabsorption of glucose in tubules in normal amount of sugar in the blood in renal diabetes, chronic nephritis, and nephrotic syndrome. Pathological glucosuria occurs most frequently in diabetes mellitus, less frequently in thyrotoxicosis and Zenker-Cushing syndrome in the liver cirrhosis. Ketones. The presence of ketones body in urine is called ketonuria. The urine of a healthy person contains very small quantity of ketone bodies which cannot be detected by common quantitative tests. Ketonuria can be present due to abnormal fat metabolism. Ketones may be indicated of poorly controlled diabetes, dehydration, starvation, long-standing gastrointestinal disorder, postoperatively, or excessive ingestion of aspirin. Bilirubin. Normal bilirubin is practically free from bilirubin. Bilirubinuria occur in hepatic and some hepatic junguses, at which the concentration of blood bilirubin in blood increase more than 34 millimole per liter. Urobilin and urobilin and stercobilin excretion of a large amount of urobilinoids and urine in the urine is called urobilinuria, which occur in diseases of liver, hemolytic anemia, and enteritis. Excessive myocardial infarction, extensive, congestive failure, and pyrexia. Microscopic examination of urine sediments. Microscopic examination of urine sediments is made from quantitative and quantitative appraisal of main urine elements. Epithelium cells of squamous, transitional, or renal epithelium can be elevated. Squamous epithelials enter urine from the external genitalia and ureter. Their diagnostic importance is low. Large amount of squamous epithelium in female can be indicated a bad clear of external genitalia, some gynecological diseases. Large amount of squamous epithelium in male occur with inflammation of urethra. Cells of transitional epithelium line the mucosa of urinary tract. The presence of large amount of transitional epithelium in urinary tract indicates inflammatory process in pelvis or the urinary bladder. The presence of renal epithelium in the urine is a specific sign of acute and chronic affection of the kidney, and also of fever, toxicosis, and infection diseases. Leukocytes in urine of a healthy person are usually neutrophils, and the amount is insignificant to 6, 9 cells in microscopes. Increased quantity of leukocytes in urine, leukocyte DNA, indicates inflammation of kidney and urinary tract. This may be urethritis, prostatitis, cystitis, pyelonephritis. Erythrocytes can be alterated and unalterated. The urine of a healthy person is free from erythrocytes or can have single erythrocytes in preparation. The presence of erythrocytes in urine is called hematuria. Hematuria can be established only by microscopy, is called microhematuria, while hematuria related to microscopy is called macrohematuria. Physiological microhematuria can be found in physiological overstate of sportsmen, for example. Erythrocytes may be liberated from the kidney, the glomerulonephritis tumor of kidney, or from the urinary tract, stones in pelvis, urinary bladder, or tuberculosis, or malignant new growth in urinary bladder or ureters. The presence of glomerular hematuria, the urine usually contains much proteins. Protein erythrocytic dissociation, hematuria with insignificant proteinuria, usually suggests hematuria associated with pathology of urinary tract. Non-glomerular hematuria can have intermittent character. Casts are proteins of cell formation of tubular origin. They have cylindrical configuration and variable size. In normal urine, the casts are absent. Helium casts are found in acute and chronic glomerulonephritis, nephrotic syndrome, and also in physiological. Transient albuminuria can be found in the urine of practically healthy people with pH of urine decrease sharply along with increase in specific gravity of urine, which is characteristic of dehydration. Presence of granular casts indicated dystrophic processes in tubules. Waxy casts are characteristic of chronic diseases of kidney. Non-organized sediment in urine consists of salts that participate as crystals and amorphous substance. The character depends on colloidal composition of urine, its pH and other properties. Acid urine contains uric acids, urates, and oxalates. Alkaline urine contains amount urate, calcium carbohydrate, phosphate, phosphates. The sediment is diagnostically insignificant. Phosphate and calcium oxalate crystals occur with hyperparathyroidism or malabsorption. Urate crystals occur with serum levels. Bacteriological examination of urine. The urine culture remains a standard procedure for diagnosing urinary tract infection. A test of antimicrobial sensitivity of identified organisms is usually ordered. Never methods help identify positive specimen more accurately and rapidly. Okay, today we finish. Please, all another information you should you should more correct study during prepare to practical classes. Thank you for attention and good luck.